In Module 14, we will cover the prevalence and economic costs of metabolic disease, risk factors of metabolic disease, common tests of metabolic function and general recommendations for metabolic health. Various sources estimate that over 1 billion people globally have the cluster of factors associated with metabolic syndrome and 171 million worldwide have diabetes. It is estimated that 47 million people in the US have metabolic syndrome. Cardiovascular disease and type 2 diabetes have been identified as primary clinical outcomes of metabolic syndrome. But those with metabolic syndrome are also at increased risk for other conditions such as hypertension, abnormal lipid levels, asthma, sleep disturbances, and some forms of cancer. The figure shows the prevalence of diabetes in the US in 1994, 2000, and 2009. The prevalence of type 2 diabetes in children and adolescents have also increased significantly in the past 10 years. Which is alarming because type 2 diabetes was rarely seen previously except in middle-aged adults. The economic cost of metabolic syndrome is difficult to estimate because of varying methods of establishing a diagnosis. Another major economic challenge will be the future cost of diabetes, because experts estimate that 54 million adults aged 20 and older have prediabetes, which includes blood glucose levels that are higher than normal but not high enough to indicate a diagnosis of diabetes. As we talked earlier, a variety of risk factors are associated with cardiovascular diseases as well as for metabolic syndrome and for diabetes. The risk factors for diabetes are essentially the same as those for metabolic syndrome but also include the following: family history of diabetes, ethnicity or race, sedentary lifestyle, history of cardiovascular diseases. The risk factors for metabolic syndrome and diabetes are closely related to those for cardiovascular diseases. However, both physical activity and exercise play a very important role in the prevention and treatment of metabolic syndrome and diabetes. In terms of common tests of metabolic function, physicians can evaluate patients for metabolic syndrome using the common clinical measures of blood glucose. The measurements of height, weight, girth, blood pressure, and metabolic blood values are all part of most regular medical checkups. Although a diagnosis of metabolic syndrome does not necessarily mean that the person has a clinical disorder, it does place the person at higher risk for developing preventable chronic diseases. Then, what are two methods used to identify metabolic syndrome in adults? The primary methods include sets of criteria and the risks associated with developing metabolic syndrome from the National Cholesterol Education Program Adult Treatment Panel 38 2004 and the World Health Organization 1998. What are three tests commonly used to evaluate metabolic function? The following are common tests of metabolic function: fasting plasma glucose FPG tests, oral glucose tolerance tests OGTT, random plasma glucose tests, and glycosylated hemoglobin HbA1c levels. This figure illustrates the relationship between the risks of having metabolic syndrome and the amount of self-reported physical activity from several studies evaluating a dose-response relationship. As no, metabolic syndrome risk drops dramatically with moderate amounts of self-reported physical activity and exercise. The Physical Activity Guidelines Advisory Report suggested strong and clear evidence that regular physical activity improves the metabolic health of at least moderately active people by 30–40% over that of sedentary people. The benefits of physical activity on metabolic health apply equally for men and women and people of all ages, and reasonable evidence supports the association for various racial and ethnic groups. Again, we are interested in the dose-response relationship between physical activity and metabolic health. With regard to metabolic health, How much physical activity and exercise is needed to see the health benefits? The recommended dose to improve metabolic health is 120 to 150 minutes of moderate or vigorous intensity physical activity per week. However, evidence indicates that risk reductions start to be seen at levels below 120 minutes per week in people who engage in leisure time physical activity. Evidence that resistance training is effective in treating diabetes is limited, although it can improve glucose control.